but we might be live now. So just a heads up.
Okay.
Great, we're live. I'm so
Yay.
excited. Thank you everybody for being here and bearing with us through my technical difficulties as we do something for the very first time. I'm really excited to be here with you all and really excited to be here with our two panelists that we have today, our two experts, Dr. Elena Tully and Jasper Leem from YHEP Adolescent Health Center. So, you know, we wanted to do this program because it's been a crazy year. You know, most of our lives at this point are online and our work is online, and we're sorting through information and trying to figure out how to keep ourselves safe during the pandemic and how to keep other people safe. So we decided that we wanted to do something with people who, you know, we can find information as library staff, but we really wanted to go to the source with people who have good health information. So my name is Megan. I work at the Field Teen Center, which is the teen library department at Parkway Central Library of the Free Library of Philadelphia. And you know, we're closed to the public right now, our buildings are, but we're open online doing lots of programs and things like this. So definitely check us out if you are a teen between 12 and 18 in Philadelphia. And I'm gonna let Dr. Tully and Jasper introduce themselves.
Sure.
Awesome. Thank you so much for having us. We are really excited to be here today and to answer any and all questions that come up. So my name is Elena Tully. I am the medical director at YHEP Health Center. I use she, her pronouns. And YHEP stands for Youth Health Empowerment Project. So we're part of Philadelphia Fight. It's a big group of different community health centers, and our mission is really to see any and all patients, regardless of someone's ability to pay and regardless of whether or not they have insurance. So our goal as an organization is really to have healthcare accessible to all. So at FIGHT, we definitely see all ages, but at YHEP, we focus specifically on young people between the ages of 13 to 25, and we're right at 12th and Chestnut, so right in Center City. I'm going to tell you a little bit about YHEP and what we do. I'll let Jasper introduce himself first.
Hi, everybody. I'm Jasper Leem. I'm a licensed clinical social worker, and my role at YHEP Health Center is I'm what's called a behavioral health consultant. If you've ever been to any of the city health centers, most of them also have a BHC on staff. The way I explain it to folks is that whether it's good news or bad news is that I used to be a therapist, but it's not really what my role is at YHEP. It's much more like helping figure out how you get from point A to point B with whatever it is in your life. So that could be anything from, you know, your mood has been funky or something really difficult happened and you're trying to navigate that, such as maybe a pandemic. Maybe you're navigating questions around like gender or sexuality or family interactions, or whether or not you want to start your own family. I am here to have like all of those conversations and sort of get to know you a little bit and help figure out what would be a good path forward for your goals. And then you don't even have to see me every week for an hour. We get to meet whenever makes sense to you. And right now I'm meeting everyone virtually. So I apologize for this really boring background behind me.
Jasper is anything but boring. So, so at YHEP, I want to tell you like a little bit about what we do to just frame kind of our experience. So we are a full-scale primary care clinic. So for a lot of people, we are their regular doctor's office. So we have very kind of typical doctor's office things. We do physicals, you know, shots for school. We treat people's ongoing medical issues like asthma or migraine headaches. And we're here when our patients get sick. So they have a sore throat, an earache, you know, we're a typical doctor's office. We also do a lot of additional things, I think, beyond the traditional doctor's office role. We offer gender affirming healthcare and hormone therapy for those who might identify as transgender or non-binary or exploring their gender identity. And we do a lot of sexual and reproductive health care. So a lot of education around healthy relationships, how to have safer sex, how to prevent pregnancy. So we do have testing and treatment for sexually transmitted infections. We offer pregnancy testing and different forms of birth control. And we offer PrEP. So for those who haven't heard of that before, PrEP's a pill that people that are HIV negative can take once a day to prevent themselves from getting HIV. Mental health absolutely is a huge component of what we do. And I think over the course of the past year, throughout the pandemic, it's been even more important and a larger percentage of a lot of the work that we've been doing. Two of the things I always like to point out when we're talking about the healthcare that we deliver at YHEP are two things. Like one is that, you know, I think a lot of young people don't know this, but in Pennsylvania and in a lot of states, if you're over the age of 13, you're actually allowed to come in without a parent for anything related to sexual health or birth control. And if you're over the age of 14, you're allowed to come in alone without a parent for mental health care. So we definitely want to make sure that people know that, you know, these things are accessible and confidential, whether or not you're coming in with a parent or not. And then just, you know, throughout the pandemic, we have, you know, paid really close attention to COVID precautions, and our goal is to keep everyone as safe as possible. So we do, in addition to being open, you know, in the clinic, we absolutely have rolled out a lot of telehealth services and do a lot of telehealth visits, which a lot of our patients have really liked and have found pretty convenient.
And for folks who are just hopping on to the YouTube now, the clinic itself is located at 1207 Chestnut Street. It's in the same building as a couple of our other clinics. We actually share the floor with our pediatric clinic, who sees folks from birth to 18. And we also have a dental clinic. There's an outpatient mental health program. So there's a lot of different programs under our umbrella organization of Philadelphia Fight. But we specialize in working with folks 13 to 25, which has been really delightful. I love our patients. I always get sad when people turn 25 because I'm like, oh, now we have to find a new spot. But we always seem to find places that are a good fit for wherever our patients are at the time.
Yeah, and our goal is really to offer care that's like really custom made for teens and young adults, you know, not making people, you know, wait 3 months to get a medical appointment. You know, before COVID, we always had walk-in hours. And so we always want to make sure that if someone's calling, like you're not getting an appointment like 3 weeks from now, we hope to get you in like the next day if you want to be seen, and, you know, really just focusing on, you know, the needs of our teens and young adults. So Jasper, I don't know if there's anything else you want to say about the clinic before we kind of roll into the COVID world.
Not that I can think of offhand. Let's run into the COVID world, because I think that the nature and the culture of YHEP will probably come through anyway.
Cool. So Megan, if it's okay with you, I was just gonna like say a few things about where we are with the coronavirus and COVID and kind of like launch into it. So
yeah,
it's always hard to know where to begin. I mean, looking back on how far we've come and how long we've been dealing with, I mean, it's been almost a year now, over a year, since we've known about coronavirus and COVID-19, the disease caused by the novel coronavirus. And as we all know, our worlds have been totally flipped upside down. And, you know, we have a lot of viruses that we normally deal with every year. Viruses cause the flu, they cause common colds, they cause sniffly noses. But this one was different, as we all know. And I think what made it different is that it was a pretty dangerous combination of, one, being pretty contagious. So it's far more contagious than our normal flu virus. Number two, it can make people really sick. And as you all know, it's led to, you know, a lot of deaths around the world. And I think number three, because it's new, not a single person had immunity to it. So no one in the world was yet protected against the coronavirus. So I think the combination of these things have really led us to where we are. You know, a year later, a year into schools being closed, people having lost their jobs, lost loved ones, having to wear a mask everywhere we go, not being able to freely see our friends and family. And, even though we've learned a lot about the virus, we've learned a lot about what we can do to keep ourselves safe. And those like primary things are, the hand washing, the social distancing, and wearing masks. It seems like there's still something new every day that we're learning about and that questions are coming up about. I see patients in the clinic every day, and I get tons of really amazing questions from my patients. Is it safe for me to go visit my grandma? Would I be okay riding in an Uber tomorrow? Do I have COVID? Should I go get a test? More recently, we've been getting questions popping up about the vaccine, which is incredibly exciting. Dr. Tully, what do you think about the vaccine? Is it safe? Would you get it? So for a lot of these questions, I have to admit, there's not a simple, straightforward answer, but I'm always incredibly happy when my patients kind of reach out and ask these questions, because I think most importantly, we want accurate information to get out there so that we can all play our part in getting our lives back to normal. Because, while there is a light at the end of the tunnel, I think with the vaccine coming on board, there's still, there are still months and months ahead of us of like responsible decisions we need to be making. And so I could, I'm sure each and every one of us in this world could give an hour plus long lecture about various aspects of coronavirus and COVID, but my goal is really to kind of stay focused on the questions that you have and make sure that we get all those answered. So for now, I'm going to leave it at that and kind of wait till we get the Q&A going to delve into some other topics. But Jasper, I think you wanted to touch base on, just the more kind of, I have to say, as a medical provider, one of the things that shocked me the most about what has unfolded over the past year for our patients in the outpatient setting has been COVID's impact on mental health. And so that's why when we were like, I was talking with Megan about having an event, and I was like, we can't do this without having, Jasper on board, being able to address some of the concerns around mental health. So I just want to turn it over to you to provide us some details and thoughts.
Of course, thank you. I think one of the things that we noticed, so, COVID really hit the Philly area in mid-March last year. And one of the first things I noticed as a behavioral health person, as a consultant, was one was that because, young adults myself included, we get, not that I'm a young adult, but I get so much of my information on the world through social media. And when it first started coming into the States, there was a ton of misinformation being sent around. My own dad sent me like a post that was like supposed to have come from like Stanford about how like if you drink lots of water, then it'll like flush the virus down into your stomach and your stomach acid would kill it. And and so it was very like taking advantage of folks who were in a panic. And then suddenly we're all told to shelter in place. So one of the things I've found really interesting is that every country and culture has reacted or responded to shelter in place orders differently. And so what's been really difficult in terms of like making behavioral changes for our own safety is that it depends really on what works in one country or in their culture is not necessarily going to work for us. My family, part of my family lives in Hong Kong, where sheltering in place, following government orders, wearing a mask even when you're out in public is actually a pretty common thing. Like before COVID, it wasn't uncommon if I was there visiting family to see people walking around with a mask on because they were sick or they had the flu or a cough or whatever it was, or because it's also incredibly polluted there. For folks there to be told to wear a mask when they're out in public, it wasn't as much of a culture or paradigm shift. This is something that was sort of already familiar on some level. Whereas here in the States, there's a lot of stigma about even like sometimes it's hard to call out from work if you're sick because they're like, well, what if I don't have the time off? Or, who's gonna take care of my kids, or how am I going to work this out? And so, I think there were a lot of culture shifts and sort of barriers that we had to get over in order to sort of align with some of those protective measures. And then also, everything that we had pre-COVID was still here with us. And so, for a lot of folks, especially in our patient age group, being out and about and socializing is like a key piece of who we are, how we develop, how we get a sense of who we are and feel grounded in our like communities and our people. And suddenly to not be able to do that, and then also be stuck with, whoever we're living with, so which could be family, could be other folks, was incredibly difficult. Even for myself, I love my partner, and also we're not used to seeing each other this much. So one of the first things I'm going to share my screen for a sec, is one of the first things we talked about, here we go, was figuring out, like, this is an infographic I have shamelessly stolen / borrowed from UCSF, which is the University of California, San Francisco. They have a whole website. Megan, I'll give you the link so that you can post it in the YouTube comments later. But they have a whole website dedicated to, like, how do I navigate through COVID and lockdown and quarantine. But this is something that I've always liked to go back to about, we really have to look at what can I control and what can't I control. We can control where I get information. We can control how I react to things. I can control whether or not I wear a mask. I can't control whether or not somebody else wears a mask. And so it's made this whole pandemic and like the need to socially or like physically really distance has forced us to have conversations with people in our lives that are incredibly uncomfortable. So I know, like, a lot of people have asked me about, like, can I form a pod, whether with friends, with family, whoever, a pod being sort of like, this is your group of folks, even if you don't physically live together. But it requires a lot of negotiation. It requires, for us, it has required me talking to my mom about, hey, I know you love to go to the grocery store and chat with so-and-so at the checkout line, but like, you can't keep doing that and be in our pod. Or, we had friends and family who got married, and how do we negotiate that with our pod and say, okay, well, if you're going to that wedding, then you can go, but before you can come back into the pod, we need you to get tested and, do X, Y, Z. But then also balancing that with, like, we have other people in our lives outside of our pod that we care about and want to be there for. And sometimes we have to be there for physically. And how do we do that in a way that is safe, not just for ourselves, but for the other folks who are, in our pod. And that involves having some really, really difficult conversations. And often people not being happy about setting those boundaries. And then on top of that, I'm sure that folks have probably seen in the news, especially in the early part of the pandemic here, was, an unquestionable rise in domestic violence or intimate partner violence. A lot of folks who, had a partner, boyfriend, girlfriend, person they were talking to, and then suddenly now you're sheltering in place with that person because you want to see them. And maybe that is a better option in terms of housing, but it's sort of created this sudden moving in situation that maybe would not have happened otherwise. And so that was something that was really difficult to negotiate. I could leave this up for right now, but I know there's I don't want to hog the time. Dr. Tully, were there other things in particular that you wanted to make sure we covered first? Or Megan?
This is great. I think you can go ahead and keep going.
So just to give a sense of basic, the general sense of how we can take care of ourselves and others during all of this. So, I mean, one of the areas of control that we all have is finding ways to prevent getting HIV. I'm so used to talking about that. It's been like parallel conversations. Talking about how to prevent getting COVID or the virus. So social distancing, doing, actually standing on those like markers at the store that are 6 feet apart, putting on personal protective equipment, hand washing, not touching your face, using virtual spaces to connect with other people when you can, limiting your contacts with other people in person. But obviously there are some things, there's some risks that we have to take, right? We might have to go to the grocery store or be in a situation where like kids or other family members we care for have to go to school or daycare, or we have to go to school or daycare or whatever it is. And so just sort of figuring out the balance for yourself of like, I have to do these activities. How can I do them as safely as possible? So there are some activities that we can say, you know what, it's fine. I will live if I don't go to a movie theater for a year. I can't believe it's been almost a year since I've been in a movie theater. But then there's other things that we really don't have as much choice around, right? Some of us work jobs where you have to be there in person to be a cashier at a grocery store or whatever it is. And so finding ways to do that in a way that feels safe to you. Mind your media. So sort of setting aside time in your day to either be away from social media. So for me, that started with, from the hours of 5 to 7 p.m., I was off of my phone. I actually would put it in a different room and walk away for a couple hours. Now I can say that other than when I'm using it for work, I generally I'm not on my phone. What I found for a lot of folks is that scrolling through and getting all this information, whether it's on the social media or even websites or news media outlets, can just be incredibly anxiety producing. And then again, to fact check the information and your news sources. So, if you are getting something that says it was from some like research study at Stanford, but it seems a little odd, like drinking lots of water is going to help you prevent getting COVID, you might want to fact check that. Asking somebody like your primary care doctor or, someone who has more of a medical background, checking the CDC website is a good place to start as well. And also, if you are scrolling or like reading about a about a difficult topic, set a timer. So I have an iPhone, so I use Siri, and I'll say, set a timer for 20 minutes. And then when that timer goes off, I make a hard decision to shut off by whatever I'm looking at. I actually have to put my phone down for a little bit, but it keeps me from spiraling into all of the what ifs of a situation. I found myself doing that a lot last week. But also, get real social support from a virtual world, right? You still have the friends and supports and the other people in your life. We just have to find a way to connect with them differently. I will tell you that a year ago, if you said that my job would be is exclusively by phone or video, I would have told you that's never going to work. And what I'm finding is that we have figured it out. And in a lot of ways, it's been helpful because, a lot of the patients that I used to only be able to see in person, we don't have to worry about did you catch the bus or have car fare to come to the clinic, because we can meet online or we can talk on the phone. And that's an option we didn't used to have. And it's actually been really helpful for folks. Practice a daily routine. So, one of the things was hardest, especially with folks not working or going to school in the same way, it's really easy to be like, well, you know what, I'm just going to keep hitting snooze, or I'm just not going to set the alarm anymore. And our sleep routine went off, our, appetite got wonky. We got into the monotony of pandemic life. And so it was really easy to feel like Groundhog Day, where you just did the same things every single day or didn't. And so finding ways to create some, even if it feels phony or contrived, finding ways to do meaningful activities in your life. Take up a new hobby, learn a new skill, get in touch with folks that you used to talk to all the time. One thing that is a weird byproduct of living in a pandemic is that everyone is going through the same thing. So it's not as weird as it used to be to call up somebody you haven't talked to in 5 years and say, hey, we're living in a pandemic. How are you doing? Because they are too. And so it become more and more commonplace to reach out to folks without necessarily needing sort of that social excuse or reason to call up out of the blue or reconnect. And then also, there's no shame in getting some professional help. We all do it. As someone who was a therapist and has been in therapy, there is no shame around getting that type of help. If you come to YHAP or to any of the health centers, that are the city health centers, they all have a behavioral health consultant as well. And it's just somebody to talk to and say, hey, I don't know how to get out of this funk, or I don't know how to make my life feel less like I'm doing the same thing every day. There are a lot of ways to, help feel like you still are a human being, even if most of your life is on a screen or, living in a virtual life.
Yeah, and Jasper, one thing I think that is important is that, I know at least for our clinic, you don't have to be a patient established at our health center to seek out, a mental health support, or you could call up and say, you know what, I saw this really cool, great guy on YouTube Live, Jasper, and I'm just feeling stressed, and I feel like it would be really helpful to get his input and talk about things. We absolutely have the flexibility to do that. We want to be here for you. And similarly, as Jasper was saying, one of the things I love most in my role is when people, find articles online, when they hear things on social media and they're like, hey, Dr. Tully, I heard this thing, what do you think about it? So I love when people bring me things that they've heard out in the real world. And we get to really talk about, the facts and what might be true or not true about certain things that people discover. So I always take notes when I learn from Jasper. So this year I'm going to read a book. That's my goal, Jasper. That's my
great. I got into audiobooks for a while too, so that was great. And I'm sure Megan could probably speak to all of the audiobooks and other resources that are available through the library system. It's been a great resource for folks. So.
Yeah, if anybody ever wants help finding things to read or watch online or on their device, you don't even have to be connected to the internet. As long as you have a way to download something, we're always available to help.
And then just aside is that it's always, always, always okay to not be okay. I think that there's a lot of pressure for us to show being strong and getting through it and just pushing through. And also sometimes it's okay that it's not okay. We are human beings. We are hardwired, genetically to be social beings. It's how we have survived for generations. And so, it's okay that this is totally weird and unusual and not what we are built for. But, thankfully we have Wi-Fi, we have devices, we have access to devices, even if they're not your own. There's definitely some folks at YHAP, because I am virtual all the time. We have folks who come to the clinic space and we just arrange so that you can use the iPad or other devices that we have so that you can still have a virtual session with me. I know the library has lots of options as well. So yeah, all of those resources are out there.
Great. Should we go to the Q&A? Are we ready for that?
So ready.
Yay.
Bring it on.
So we collected questions from teens in Philadelphia on our Instagram, on our Discord server, on our Facebook, via email, and we're going to ask those questions. I think that you should have gotten them ahead of time, Dr. Tully and Jasper. So I don't know if you're prepared to just launch into answers, but I'm going to go ahead and ask the questions. I think that makes sense.
Great.
So a question for Dr. Tully. lot of people are really curious about vaccines. And somebody said they're curious about what happens when enough people get vaccinated. Like, what will life be like, and to what degree will it be safe to go back to normal?
Yeah, and I mean, I think that is the question of the hour. I think we are all so eager to know what life will look like in the future. I think I want to make a little caveat before I like delve into all of these like COVID specific questions, is that like I am by no means like the world's expert in COVID, right? And so and I think a lot of people aren't, right? That's what's been pretty humbling about this whole experience, is that we're all learning more and more and more about the virus every day, and kind of what, you know, what the future might look like based on that. So, you know, first answer to that question is like, I have no crystal ball to know exactly like, you know, how long this is going to take once we have this vaccine rollout, and what exactly life might look like, because we've hit bumps and snags along the way. But what I will say is that, you know, when we think about using vaccines to prevent disease, we do rely upon this principle of what we call herd immunity. So we know that we need a certain number of people to get the vaccine to prevent it from spreading, right? And how many people that need to be vaccinated can vary depending on how contagious the virus is, right? So, you know, if you're in a classroom of 30 people, you know, if only 3 of those people are vaccinated, and, you know, the other 27 are not, you can see very quickly that like that's not going to be protective, right? The vaccine or the virus is still going to spread amongst those like 27 people who weren't vaccinated. So the magical question is always like, how many people do we need to get vaccinated to really, you know, prevent this from spreading? So every virus is different, and we have some estimates for the coronavirus, and you know, right now, based on how contagious it is, we're estimating anywhere from like, you know, I've heard anywhere from like 60-70% of people need to be vaccinated, all the way up to 80% of people need to be vaccinated to kind of experience this herd immunity, in which, you know, even those who may not get the vaccine are still protected because so many people around them are protected. So, you know, I think the question right now is all in, you know, the rollout of the vaccine, right? How quickly can we get this vaccine out into the community, and quite frankly, like how many people are going to be interested in getting it? You know, I think it's a new vaccine. It kind of got rolled out, and it's I think people still feel like they have a lot to learn about it, which is one of the major reasons why we're here, and want to make sure people have all their questions answered. You know, so the city is following, you know, the CDC guidelines in terms of like priority groups, and we're currently in our phase 1A, in which we're rolling out vaccine to, you know, essential healthcare workers and people living in long-term care facilities. And so, you know, as more and more vaccine gets produced, you know, each phase of the rollout will be extended, you know, to essential workers, to teachers, to people that are, you know, 65 and older. And I think based on what we know in terms of vaccine supply, you know, we anticipate that, you know, again, this is ballpark, you know, but by spring, summer, that we're going to be able to start offering the vaccine to, you know, to anyone that wants it, with the goal of, you know, maybe by fall 2021, you know, having sufficient numbers of people being vaccinated so that by end of 2021, like, you know, we're going to get to maybe those levels that, you know, might get us to herd immunity. Again, I think that certainly it's like up for change, but you know, then I think the question is still there that you posed. It's like, well, then what will life get back? You know, what will life look like? And I think everything is going to happen in little waves. I think as more and more people get vaccinated, you know, and the numbers kind of start to drop off. We're watching the numbers in the city and across the country daily. So, you know, as vaccine numbers rise, and as the cases kind of start to fall, you'll start to see little by little, like, you know, cities starting to open up. Like every day, you know, Philadelphia is just, you know, providing more guidance today around like, things that might open with limited capacity. And so I think that those sorts of things, they're not going to be one day where like, okay, boom, we've hit it, we're open. I think we're going to see this gradual increase in kind of activities we're allowed to engage in and that sort of thing. The one important thing I do want to say about the vaccine right now is that like in a lot of the research studies, the endpoint to show effectiveness of the vaccine was that people who got the vaccine did not develop severe disease. What we don't yet know is whether or not the vaccine is really effective in preventing transmission. So even if I'm vaccinated, I might not get, severe disease, but is it still possible for me to spread to other people? And so the guidance, even after vaccination right now, until we get more info, is that people, still wear masks. We're still following social distance guidelines. And hopefully we'll have more data as more and more people get vaccinated as to how effective it is in preventing transmission. So not an easy answer, but none of these will be.
One thing that people have said is, well, is there any of the virus actually in the vaccine? Am I putting a little bit of the virus in my body when I get a vaccine? Can you talk about that science at all?
Yeah, no, I mean, this is kind of the question of the hour for sure. Because this technology, the mRNA technology that there are two vaccines right now that we're talking about that have been approved in the US. So we have the Moderna vaccine and the Pfizer vaccine. And both of these utilize what's called mRNA technology. And it's exciting new technology in the vaccine world. It's not necessarily new technology in medicine and in science. We've been using it for years in terms of cancer treatment. So I think we have a lot of data about its like safety and effectiveness kind of outside of the vaccine world. But it's actually really cool. And this is totally the science nerd in me. But the way it works is like, scientists like looked at the virus itself. So the virus is made up of almost 13 different proteins. And there's one protein, it's called the spike protein. So you'll often hear about the spike protein. The spike protein kind of are these little spikes on the outside of the virus. And they're what help the virus kind of get into our cells. So the spike protein is really important for the disease spreading. And so what scientists were able to do is they were able to break down all of the genetic code for the virus, and they found these the very specific codes that make this one little spike protein. So that's called the mRNA. mRNA is what codes for our proteins. It's like the little code that tells our body to make the proteins that exist in our body. So they got this mRNA code, they isolated it, and it's not the full virus at all. It's a little code that tells us how to make one little protein, on the edge of the virus. So the vaccine is pretty simple. The vaccine doesn't contain a lot of extra things in it. It's really this tiny little code. They put it in a little bubble of fat so that when it gets injected, it can get into our bodies and work inside our bodies. So the same code that the virus uses is the same code that we use in our bodies. Like our bodies have this messenger RNA in it that our bodies make to tell our body to make proteins. And so what the vaccine does is, the mRNA comes into our body and our cells pick it up, and all of a sudden, I have a cell in my body that makes a little spike protein. And I think the immune systems of our body are like the most incredible feats of science. My body now makes a little spike protein because the mRNA in the vaccine told me to, and our body is like, whoa, that is not normal. Elena Tully's body should not have a spike protein in it, right? So it kind of sees that as something foreign and not normal. And our immune system comes and, basically builds this army of immune response against it. So, we have B cells that make the antibodies and T cells that help our bodies remember, past infections. And so when our body sees this spike protein, it kind of calls the forces. It calls these B cells and these T cells up so that we have memory in the future. for recognizing this spike protein. So, you know, that code that got put into our bodies, like that code, you know, dies off. That code doesn't last. It's just like a little bit of like a recipe, you know, instructions for how to make this spike protein. But what does last is the, you know, the immunity in our own bodies that kind of hangs around, so that next time, you know, my body, you know, if and when it sees the coronavirus, it remembers this spike protein, and it's like it's ready to fight. So it's certainly, you know, it's complicated, it's science. And, you know, what I have loved, I found some really awesome like scientists on Twitter who've been able to break it down and make it really accessible. And so I think it's, you know, I really like when these questions come up, because I think, you know, when people are deciding to put a vaccine in their body, you know, it's really important to know that and feel comfortable that what we're doing is safe. Did that all make sense? That was like a whole lot of science. So
it was really, I thought it was really cool. Even if I don't understand it fully, it's really interesting to hear about. Another question that people had, you know, in the news, you've been seeing a lot about the new strain of the virus that was discovered in the UK. And somebody asked if the vaccine would be effective against the new strain as well as the original strain.
Yeah, and that's been definitely a question that has come up a lot. So, you know, one thing I'll say, I think it was back in November maybe, that there was this new variant of the coronavirus that that popped up, and they were finding was, you know, more and more common in the UK. And what I will say, the first thing is that new variations of viruses, like that's normal. Viruses mutate, you know, they have little changes in their codes, and they mutate all the time. This is why there's a new flu vaccine every year. This is why you have to get a new flu vaccine every year, because every year the flu is like making these like tiny little changes to its structure. And we need to make sure that, you know, we're targeting the right, you know, the right flu. So it's not unexpected that a virus has mutated. There's a new variant. And what I think has been really important about this variant is that it seems to be far more contagious. It spreads a lot more quickly than the other coronavirus that we had traditionally been seeing. There's no evidence that it's any more dangerous, that it causes more severe disease. We have no information around that at this point. And so, you know, all of these vaccine trials, like they definitely did not include this new strain of coronavirus, the UK variant. But, you know, what we do know about the way that the vaccine was developed, I kind of told you that, you know, our body, like we're relying on our body to create these little antibodies against the spike protein, right? So when that happens in our bodies, we don't just make one type of antibody. So those are the cells that will help us like fight infection in the future. Our body makes a lot of different antibodies in response to seeing that protein. And so one tiny little, you know, mutation, one small mutation in a, you know, in the virus, this new variant, there is like no indication that it would be able to, you know, avoid all of the different antibodies that our bodies are creating. So every scientist that I've heard from, everyone that I've heard, you know, talking about the vaccine is very, feeling very reassured that even though the virus was not tested in vaccine trials, that, you know, based on what the virus generates and what it creates, is that, you know, we anticipate that the vaccine is going to be just as effective for this new virus.
And is there anything that would be different about getting the vaccine for people who are under 16 or under 18? Like, will children and teens also have vaccines available to them?
That's a really, really good question. And I actually meant to say this from the get-go. So for right now, it's the Pfizer vaccine that is, there were some 16-year-olds in the trials for the Pfizer vaccine. So the Pfizer vaccine is actually approved for use in those kind of as young as 16. The Moderna vaccine did not have anyone under the age of 18 in their clinical trials. And so the Moderna vaccine is only approved for individuals that are over the age of 18. With all of that said, you know, pediatric trials are currently underway across the country. I know I have many colleagues that I trained with in medical school that have their kids enrolled in these trials. And so, I think it is really important that we do the trials specifically in kids, like in the younger population. It's really, not necessarily appropriate to just assume that it's going to be fine in kids. We know, especially with the immune system, that, kids have a different immune system and have much more rapid ability to develop immunity. And so we don't want to kind of just say, because it's available for adults, like, yes, it's safe to use in kids. So for right now, we're good to vaccinate, in 16 and up with Pfizer. And I imagine, by the time we're getting to the point where we're vaccinating our younger, demographic anyways, that we'll have more information and data around whether or not these vaccines will be available for the pediatric population.
That makes sense. Thank you so much, Dr. Tully. I want to make sure we have time to get a couple of mental health and wellness questions in with Jasper. Jasper, somebody asked about practicing self-care at home. I know that the information that you gave was really great. Things like, creating a routine and making sure that you keep in touch with people. But if somebody is really struggling and they feel like they need some self-care at home, what would you recommend?
I think the funny thing about this question is that self-care, almost by definition right now, has to be at home, right? A lot of the things that we folks have done for self-care in the past, whether that's, that might be going to a gym or hanging out with friends or going to a happy hour, or maybe not as teens, but, those social activities, or, going to a spa or getting your nails done are, have come and gone in terms of availability off and on since the beginning of the pandemic. So doing these things at home, there are some things that if this makes you feel good in general, or like helps you relax, finding ways to do it at home is a great start. So to use some examples, like some of my friends used to love getting their nails done every, a couple of weeks. It's not something I do, but and so they figured out ways to do that at home and learn how to do it for each other, or started doing YouTube videos on how to do your own cosmetics or whatever it is that makes you feel good and relaxed. If you have a bathtub, I think a long bath can go a long way for a lot of folks. There's actually more recent studies on how taking a relaxing bath can actually have an impact on your mental health, and just help you disconnect from the world, especially when we are connecting in such a strange way, almost 24/7 right now. So getting to disconnect and take a bubble bath or whatever, they found that cultures and people in general who take a bath for 30 minutes or longer, and doesn't have to be not like a hot scalding bath, something nice and relaxing, that their scores on a bunch of these qualitative tests on how are you feeling, how depressed or not depressed are you, but they scored less depressed and less anxious than folks who only took showers, for example, which I found fascinating. And I love that there was an actual study that had to be done for that. In terms of other self-care, I have a couple new playlists since the pandemic, because I know that music is something that has usually helped me get out of my head, or help me take care of myself. So if music is something that you use or used to use as an outlet, I have one playlist for when I am totally aggro and PO'd about something and I just need to vent, but I can't just go to my office mate next door anymore and be oh my gosh, this happened and blah, 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 blah. It doesn't feel right to call them and be hey, you would not believe what just happened. I'm so, PO'd because my, whoever in my life did this thing. I still need to vent. So, I have one playlist that is just for that. I have another one for when I am really feeling isolated and lonely, that just makes me feel a little bit better, for no particular good reason either. It's a really odd playlist. So finding those things that can be helpful. I took up some really weird hobbies, and I'm not even going to pretend to be ashamed about it. Like this summer, I learned how to carve a spoon out of wood because that's what Amazon thought I should do. I don't necessarily support Amazon, but it sounded like a good idea, and it was actually kind of fun. It's now my kid's favorite spoon. Who knew? So just things like that. You know, I think there's a lot of permission in the strangeness of our lives for the past year there's a lot of permission to try things that you wouldn't usually do. You know, on top of, our usual, keeping a routine, trying to wake up and go to bed around the same time every day. In the beginning of the pandemic, I would talk to folks about like sleep hygiene or like having a good sleep schedule. And in the beginning, because all of our lives were so upside down, it was like, hey, let's just get a sleep schedule. I don't care if that schedule is you fall asleep at 3 and you wake up at noon. Great. Let's just keep that for a minute, right? It does not have to be like, oh, and I was in bed by midnight and woke up at 8 a.m. If that's not practical and you don't have to be up at 8 a.m., let's figure out what works and then walk it back to a place that feels healthy or right for you. And maybe that is 3 a.m. to noon. Certainly, there's been an increase for folks who like you do any like substance use. There has been, the opioid epidemic didn't go anywhere during this pandemic. And so something to keep in mind if you are someone who uses certain substances is to try not to use alone. Make sure that you have other folks in your life or like physically around you or in your pod who are aware of what's going on, because the risk of overdose is so much greater if you are alone or isolated in a house, because there's no one there to revive you if you do overdose. And so finding ways to connect with other folks just to reduce your risk around that. Finding other community support is really helpful. A lot of the community supports that are out there have gone to online platforms. Plus, you also still have, Twitter and Tumblr, and my Pinterest has gotten really weird over the past few months. Like, this is a chance to explore and study and figure out what you enjoy doing in a way that we might not have been able to do if we had all of those normal distractions during the day.
That's so great. Thank you. Those are really good ideas. Really good thoughts. I have one more question to end on. It's kind of heavy. Maybe we won't end here, but I know a lot of people have been talking to me about how difficult it is to navigate relationships with friends and family members, especially when, you might be living with people and have difficult relationships with the people that you live with, or maybe things were fine and then COVID came along and now you're trying to navigate like, well, I think this is how I would like to be safe. And maybe that's different than like your parents or friends. How do people navigate like those tricky relationships?
Oof, it is.
I know that's a big question.
It's all right. I mean, it's not a question that I can answer in 5 minutes, but relationships are hard, period. Pre-COVID relationships were hard. During COVID, relationships are hard, and we're stuck literally physically with them sometimes. So I would start with, having these conversations with people we love is always difficult. Setting boundaries with people we care about is a skill, and it's one that is hard to learn and not one that we're necessarily taught growing up. If you are, fantastic. But it is really difficult to navigate that. I think I mentioned like, even with the folks that are in my pod, like I've had to say like, hey, I know that going and doing this thing is really important to you, whatever that is. And also I don't feel comfortable being in a pod with you and like being in a maskless indoor space is safe for me if you're going to keep doing that. And so having to make those decisions of saying, hey, I really love you and care about you and I want you in my life, but I also want to be alive for it, is a really hard conversation to have. And I think what's hard also is that for folks who are not in like those high risk categories, who are not over 75 or have other health conditions that put them at risk for like severe COVID complications. What's hard is that we're not just talking about us, but we're also talking about all of the people that we are potted or exposing ourselves to, right? So, I definitely have friends who said, I want to come see you, or I want to come do this event or whatever it is, but I can't because I live with my parents or grandparents or whoever who's in this high risk category, or I have a partner who has hypertension or diabetes or any of those other risk factors. What this virus in particular has really forced us to do is to look beyond just our own health, because that period that really like scared a lot of us and still does sometimes, that period where we could have the virus and be asymptomatic or not have like clear signs of it, but still pass it to other people. That's where we're really looking at, folks who are otherwise healthy posing a pretty serious risk to those who have those other risk factors. And it's very different than, I remember in my early social work days, we were talking a lot about that in terms of HIV, which is like you have to do some pretty specific things to get or give HIV as a virus, more than just being, not wearing a mask and being in a, indoor space. So, because it's so much more easily transmitted, and in these very sort of casual ways, the risk that we pose to other folks is really hard. Dating is incredibly hard right now. You got to get really creative. I love that there are all kinds of apps and websites where you can like watch a movie with your boo and comment and do all those things. I get, of course, we all want to like physically be with those people that we're interested in or talking to or whatever. Finding ways to do that in a way that feels safe to you, that could involve, checking in about how you're feeling physically. That can involve negotiating how you want to do a pod if that is something you are interested in. I think what's hard is that everyone's comfort level is really different with this.
Yeah.
That being said, it's always a good skill to learn in any relationship. So I'll leave it at that.
Thank you so much. We're at 5, so I guess we'll wrap up, even though I feel like we could keep going. There's so much to talk about, but thank you both so much for being with us. If people are interested in reaching out to YHAP, either for mental health services or for health services, how can they get in touch with y'all?
I think the website is already posted in the YouTube channel comments. I am working remotely all the time, so folks can reach me if they want to do a behavioral health visit with me. The easiest way is probably to call our main number, which is 215-344-1632, and just let them know that you want to schedule an appointment with Jasper or a medical appointment. Let them know if you're a new patient. And just a reminder, like even if you don't have insurance, or if you have insurance but your copay is something more than you can afford doing, like we will always work around that. So in fact, I think that's one of the things I love most about how YHAP gets to function.
That's awesome. Yeah, we're really excited to partner with YHAP because we know that you're a great organization doing really good work with young people in Philly.
Yeah, and I know that I feel so grateful to be here with y'all, and I know that you reach so many young people, and I think that's been one of our challenges throughout this time is that, because it's not as easy to come in and walk in and get into the clinic, that we want to make sure that we're reaching young people and getting all this information out there. So we are happy to, be useful in whatever way, Megan, you can find, whatever way you find useful. It's, I'm happy to field questions, happy to get back on here again and, pick certain topics or, whatever young people need, we are happy to be a resource to make sure that those questions get answered. So just keep us posted.
That's great. Yeah, and if anyone is curious about the Field Teen Center, if teens have any questions or want to get in touch with us, you can always find us at freelibrary.org. You can always email us at teencenter@freelibrary.org. or you can find us on Instagram at FLP Teen Center. Yeah. So thank you everybody so much. This video will stay online. So if people have more questions, they can always reach back out, comment here, and we'll make sure that you get your questions answered. Have a good night.
Thanks for having us.
Thank you.